Hello, welcome to this presentation from Shine on financial assistance for Medicare beneficiaries. Shine is part of the federal SHIP program called the State Health Insurance Assistance Program, offering free and unbiased Medicare counseling. Every state has a SHIP program. In Florida, that's Shine. Shine is the Florida SHIP program and also the Senior Medicare Patrol program. It stands for Serving the Health Insurance Needs of Elders. And it's brought to you through Department of Elder Affairs, whose vision is for all Floridians to live well and age well. Our mission here at Shine is to provide this free and unbiased health insurance counseling through volunteers who have been trained with Department of Elder Affairs, and their counseling empowers Florida seniors to make informed healthcare choices. Shine is a free program offered by the Florida Department of Elder Affairs in partnership with your local aging and disability resource centers. Specially trained volunteers can assist you with your Medicare, Medicaid, and health insurance questions by providing one-on-one counseling and information. Shine services are free, unbiased, and confidential. Shine is not affiliated with and does not endorse any insurance company or product. There are 11 aging and disability resource centers in the state of Florida. These are nonprofits that Department of Elder Affairs contracts with to bring you these important programs like Shine and the Elder Helpline. Every single county in the state of Florida is served by an aging and disability resource center. And you can call the state phone number to find out your local aging and disability resource center at 1-800-963-5337. Senior Connection Center serves 5 counties in the state of Florida, including Hillsborough, Polk, Highlands, Hardee, and Manatee counties. Shine counselors can help with any Medicare-related question, including original Medicare, Medicare Advantage plans, questions about Medicare prescription drug coverage or Medigap, also known as the Medicare Supplement Insurance. Medicare counselors can also help a beneficiary determine whether they are eligible for the Medicare Savings Program or the Extra Help for Prescription Drugs program, which we'll talk about a little bit further today, and can help give information and educate beneficiaries about Medicare fraud and abuse. They can also help with long-term care planning and Medicare complaints and appeals. Information about eligibility relating to income and assets is a little bit more detailed on this Shine handout, which can be printed out from this presentation or found if you go to floridashine.org, resources, and then drop down to extra help. The Medicare Savings Program is a program that helps with the costs of Medicare. Senior Connection Center has a grant to help with these Medicare financial assistance programs, including the Medicare Savings Program and the Extra Help Program. You can simply call us or talk to a Shine counselor. We can help let you know if you are eligible for these programs and help you with the applications as well. We are doing electronic applications, which result in a quick turnaround with information about benefits. The Medicare Savings Program is jointly funded by state and federal finances. Eligibility is based on income and assets or resources. A beneficiary would apply through Department of Children and Families Access Florida, which is the state Medicaid agency. And limited benefits for the Medicare Savings Program would include help with Part A premiums, Part B premiums, deductibles, and copays. When someone applies for the Medicare Savings Program, they would be asked questions on the application about their income and assets. If you receive Social Security, you would have to provide your gross monthly amount of Social Security before deductions. Also, if someone receives any pensions or annuities or alimony, that would have to be reported, including if you're either self-employed or working for someone else. Income and wages would have to be reported, including any other contributions. Regarding resources or assets, questions are asked about amounts in your bank accounts like savings, checking, or CDs, and cash is considered an asset as well. If someone has any investments, stocks, bonds, mutual funds, IRAs, that information would have to be reported, and any additional real estate owned other than your homestead would be considered an asset, including life insurance policies that have a value over $2,500. Now we'll talk about the financial assistance program called Extra Help for prescription drugs. This is a subsidy that is offered through Social Security, also known as the low income subsidy. It helps with prescription drug costs, and eligibility is based on income and assets. Questions about those income and assets are similar for this particular application, similar to the Medicare Savings Program that we just went over. If someone is in the coverage gap and covered by Extra Help, they would have minimal drug costs. And if you have Extra Help, there is a special enrollment period. That enrollment period allows someone to change their Part D plan if they need to in any one of the first 3 quarters of the year, one time in each quarter, and in the 4th quarter during open enrollment, which is October 15th through December 7th. If someone receives Extra Help, there are 4 different levels of Extra Help based on their income and assets. If you fall in the lowest 2 levels of income and assets for approval, you most likely would get full Extra Help. You wouldn't have to pay a Part D, D as in drug, premium, or Part D deductible, and co-payments would be minimal. If someone falls in the highest 2 levels and has been approved for Extra Help, and that's the highest 2 levels of income and assets, they would get something like partial Extra Help. With partial Extra Help, one may pay either no Part D premium or possibly a reduced Part D premium. Their deductible would be limited to $89. That's the cost of the reduced deductible for partial Extra Help in the year of 2020. And their copays would be limited to 15%, the cost of the drugs in their formulary. And now we'll go into a little bit of information about Medicare fraud and abuse. Medicare counselors can help educate Medicare beneficiaries and answer questions. But one way that someone can be alert to Medicare fraud and abuse is to really know the difference between the two, and that is intent. Medicare fraud is purposely billing for services that were never given, whereas Medicare abuse is the payment for items or services that are billed by mistake by providers. You can help prevent yourself from being a victim of Medicare fraud and abuse by protecting your red, white, and blue Medicare card, just as you would your Social Security card. And do not give that information out to anybody who you have not called for help. Also, you can protect yourself by detecting and watching information that comes through on your Medicare summary notices. Review those claims. Check for mistakes. Call your provider if you have any questions. And if you see something that looks unusual, say something. Call Shine. We're here to help. 1-800-963-5337. We're open. Please call us.